Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today I am joined by Sam Wood, Head of Product at Meddbase, and Greg Jennings, Chief Engagement Officer at Beyond Blue. Today we're diving into an important topic around mental health, and we'll unpack it further, specifically into workplace mental health and enabling some solutions that can perhaps address one of the possibly the biggest issue in healthcare in Australia today and the role that technology plays in that. So Sam, Greg, thanks so much for joining today.
Thank you very much for having us.
It's great to have you here, and it's that the power of virtual bring us together from across the world, but addressing a problem here in Australia, and we'll work that out in a little bit more. But maybe if I can get your help in introducing yourselves, please. So firstly, Sam, tell us a bit more about you and what you do.
Cool. Thanks, Pete. Yeah, I'm Sam Wood. As you mentioned, I'm the head of product at Meddbase. So we are a software provider. We work with healthcare businesses across a wide range of industries and have been doing so for about 20 years now. I run the product department within the company, so work very closely with our customers, trying to figure out what problems they're trying to solve. I've been in product for the last 6 years, and before I started work at Meddbase, I actually worked in the occupational healthcare space, helping to run line of business systems for OH companies. So I've kind of got a bit of that experience on the client side, working with software vendors, and then obviously on the software vendor side, working very closely with clients. And it was an absolute joy to work with Greg and the team at Beyond Blue, and I'm really excited to talk more about it.
Yeah, excellent. And you've got a bit of a global presence as well, Meddbase, is that right?
That's right, yeah. So our customers are based across, the UK, Europe, North America, Canada, and the States, and then very importantly, Australia is a new emerging market for us, and it's a really exciting place to be.
Amazing. And Greg, tell us about yourself.
Thanks, Pete. Thanks for having us on the show. My name's Greg Jennings, Chief Engagement Officer at Beyond Blue. Beyond Blue is one of Australia's most well-known, trusted and accessed mental health organisations. We've been around for about 25 years, and our role is to work with the community to help people feel better earlier, get well and stay well. So we're all about earlier intervention for mental health, helping people get access to mental health supports as soon as they're starting to struggle, not wait until they reach crisis. A lot of people know us for things like our 24/7 support service, which helps hundreds of thousands of people in Australia, often in their darkest times. But we've also worked in settings like workplaces for over 20 years as well. So really keen to share some of our learnings and observations from that work.
Yeah. Well, look, if I think Beyond Blue and mental health, two things come to mind. Beyond Blue, most of the population in Australia would at least know that it exists. But I think as well, particularly in healthcare, most of the population knows that mental health specifically is in a bit of a dire state, but I don't know the latest. You're in the thick of it in terms of the issues around mental health. Tell me the current state of mental health in Australia right now.
Yeah, look, you're pretty spot on. It is quite dire. It's not a particularly positive picture to paint. For many people right now, they're doing it really tough. So what the stats tell us is that in any given year, around 1 in 5 people in Australia will experience a mental health condition. And about 43%, so almost half the population, will experience a mental health condition in their lifetime. That's their stats from the Australian Bureau of Statistics, and they've run studies in 2007 and in 2020 to 2022. So there was a 15-year gap between their studies, and the rates of mental health for adults in that 15-year period remained pretty steady. That's despite record investments in mental health care. The prevalence of mental health conditions aren't decreasing. And in fact, amongst our youth, we're seeing a 50% increase in youth mental health conditions. So we're in the midst of a youth mental health crisis. And when you take a bit of a step back and you think about the world in which we're living today, and you think about the drivers of poor mental health and the drivers of distress, it's not particularly surprising that we're in this state. So we are more and more using this term VUCA to describe mental health. So VUCA means volatile, uncertain, complex, and ambiguous. And we think that pretty accurately describes the world in which we're living, where social cohesion's declining. There's increasing division in the community, and more people than ever are feeling lonely, and lonely on months on end with no one to turn to. there's a 24-hour news cycle that it's just unescapable for some people. Economic uncertainty, the cost of living crisis, people are doing it really tough. And about half of all people in Australia are saying the cost of living crisis is impacting their mental health. And then, technology is a double-edged sword. It presents so many opportunities like the ones we'll talk through today, but it also presents risks to mental health. So, there's a lot of these pressures. People are really feeling the compounding nature of these pressures. So it's pretty tough. But look, there's hope. I think the hope is that there are more solutions and more support available now than there ever has been. And that's thanks to, things like our partnership with Meddbase. So the help is out there. And, at Beyond Blue, if I could just leave people with one message, it's that the sooner you reach out to that support, the better.
Well, look, I mean, I think about it too, as you've very eloquently pointed out, it almost feels like all roads lead back to mental health, where like technology and the cost of living and the life. It can almost feel a little bit nebulous saying this is mental health, if you know what I mean. Like, is there is there stuff that falls inside a scope, outside of, because often people might think, well, depression or and that becomes, well, that's my mental health in inverted commas. But sometimes we use this term quite common, like not to get into semantics, but I feel like that might be important too.
Oh, absolutely it is. And I think, what we do see is people conflate the term mental health with mental health conditions and illness like anxiety and depression. People, when they think of mental health, they think of kind of this biomedical model that we've had for a long term, that a mental health condition is an illness, and it's, it's genetic. But what we know is mental health is actually a state of well-being. Everyone has mental health, and our mental health exists on a continuum. And if you think about it from green to red, green is when we're healthy and thriving. So we've got good mental health. It helps the way we function. It means we feel good. We can connect with others. We can function well at work and as we learn. In the middle is where people are amber, and, you might feel unsettled. You're not quite unwell, but you're not quite yourself. And then if in the red, that's where people are either in crisis or experiencing symptoms of a mental health condition. And, people move up and down this continuum on a daily basis. So everyone has mental health, and our mental health is impacted as much by what's happening inside our bodies as what's happening in the world. And all those pressures that we've discussed have a huge impact on our mental health.
So it's a big topic, and we could spend a lot of time of it. I think about the total population. Another thing we spend a lot of time doing is working. Like there's outside of sleeping and working, some people are like, well, there's not much more else that I do. So hopefully not. But if you're spending so much time within workplace, then tying those two things together, mental health and workplace, seem like a pretty important thing to do.
Oh, look, absolutely. I couldn't agree more. We spend, a third of our life at work. Well, most of us do. And it has a really big impact on our mental health, either for the better, or in some instances, it can be, it can be one of the risks to our mental health. Workplaces are basically a microcosm of the broader community. So, it's all of those pressures that we're already dealing with in an environment where, there's workplace pressures, and people bring their whole self to work, but they also bring their strengths and their skills and their experience into this work environment. So ultimately, what we know is work is, when you take it all things considered, work is good for your mental health. So if you look at, comparing people who are working and who aren't working, generally being employed is a good thing. But good work is even better. So good work is work that's designed well. So where you have a stimulating job, where you can put your skills to use and you can learn new skills, when you've got a sense of autonomy and control over the work that you do, where you feel supported and you feel connected to others, so you can do your work with other people and problem solve together, and where the demands on yourself in terms of your workloads are tolerable. That's what well-designed work looks like. And obviously there's other really important things, like making sure you're not experiencing bullying, discrimination, and sexual harassment, the safety side of things as well. But that type of really well-designed work, it's a big contributor to our mental health. So it gives us a sense of identity. gives us a sense of meaning and purpose, gets us out of bed in the morning. It gives us people to interact with when we're feeling isolated. It gives us an income, which is a sense of financial security and financial independence. So, the workplace is really a great setting to promote good mental health, but we also need to make sure we're managing the risks to people's mental health and supporting them when they need it as well.
Yeah. Hey, you mentioned earlier in the conversation that workplace mental health has been a big part of what Beyond Blue does and has done for I think you said 20 years.
Yeah.
Tell me a little bit more about what that looks like.
Yeah. So look, we've been involved in promoting mentally healthy workplaces for a long, long time. That has involved, big national initiatives like our Heads Up initiative, where we worked with, a whole bunch of different stakeholders, unions, business associations, government, the broader community, employees themselves, to provide really good practical advice about how to set up and manage a mentally healthy workplace. So we've done a lot of really good work like that. But I think, most recently, what I'm most proud of is some of the work that we've been doing around a new program called Before Blue, which is some of the work we've been doing with Sam and the team at Meddbase, where we're creating new models of care for workplaces, which are helping people get support earlier. So not waiting until they reach crisis, not waiting until they're in that red end of the continuum to start to act. We're moving upstream. We're bringing that support much earlier, when someone's feeling unsettled in that amber category, and giving them really practical, evidence-based, effective support so they can get back on their feet and feel better sooner.
I'm keen to learn a little bit more about what that looks like in a second. But if I think about employers, let's say Australia specifically, there could be different approaches within the culture around mental health and employee well-being, and the role that the corporate or the company has, or the organization has in that. Many might take a purely governance approach of, well, we have a responsibility and it's a legal requirement, and the safety side, and that's certainly important. And if all roads sometimes just lead to the EAP, the Employee Assistance Program. If you've got an issue, call the EAP. You can call it whenever you like. The amount of times I think anyone has heard that is, depending on your employer, is a thing. There's other organizations that make it as part of their culture, their DNA, and the healthy workforce in physical and mental is super important. How does this Before Blue piece tie in with things like your stock standard EAP, and not discounting or discrediting any of the service there, but there's certain tools we have within the toolkit as employers and companies. Yeah.
Look, I think you're right. There are a variety of supports available. There's a bunch of programs out there, and employers do adopt different approaches to their workplace mental health strategies. I think if someone's looking at this from the perspective of, I've got legislative obligations and I want to do the bare minimum, that'll keep you out of jail, but you're doing your business a real disservice. You're doing your staff a real disservice, and really businesses are people. So what we suggest is people adopt a much more holistic approach to workplace mental health, where you focus on preventing the risks. That's what you need to do. You need to make sure that you understand what the risks are to someone's mental health in their role, in their occupation, in their team, and you put steps into place to mitigate those. But the other two areas are promoting the positive. So how you're adopting strengths-based approaches, good leadership, good work design, some of the things I talked about earlier. And then thirdly, I should say, implementing evidence-based supports for people. This is where EAPs and Before Blue start to differ. So EAPs, you would have heard about them in the past. You probably have been directed to one at some point in your life. And that's normally when, the organization's going through a big change, or you're quite really obviously not feeling yourself. And it's almost a last resort when your manager says, hey, look, why don't you talk? I've noticed you're already at this point. Why don't you go talk to an EAP? But Before Blue is much more focused on prevention and earlier intervention. So again, it's really shifting the focus of workplace mental health and of mental health more generally upstream. So we're not waiting for someone to get that unwell before they reach out for support. So, Before Blue's unlike EAP. So EAP is kind of responsive. It's about a particular issue. Call this number, help address that particular issue. Before Blue, it's much more focused on building practical skills, working with a coach over a series of sessions. It's a structured program rather than, a once-off or a couple of session service. This is a structured program that's highly evidence-based. It's built on a model of care from the UK that has decades worth of experience. We've been running it in Australia for over 10 years ourselves, and we've now adapted it to the workplace setting. So what makes it unique is that it is this really highly evidence-based, highly structured process where you work with a coach on what issues or challenges you're facing, and then they help you develop a plan to address those, and in doing so, develop really practical skills that you can use for life. So you develop coping skills that, when you face adversity in the future, you've got a really well-equipped toolkit that you can draw on. And that's a real difference. The other thing that we are really focused on, which is a bit of a differentiator, is the way that we work with people. We've got a really strong focus on measuring outcomes at every step of the way. So, when someone enters the program, there's an intake session, and we measure their mental health at that stage. Then there's 5 sessions they work with a coach on, and then there's 2 follow-up sessions at the 1 and 6 month mark. So there's 8 sessions all up. And at every step of the way, we measure a person's mental health and we show them and we say, hey, here's how you're progressing. That's an incredible motivator for someone. But it's also good for the business, who they don't see any individual results, but they just see aggregated data, so they can see the impact the program is having on their workforce at a macro level. They can see people are getting better, and that's often not the type of thing that you see through EAP programs. And that level of data.
Just to jump in on that point, like, we know that across pretty much every health condition, right, prevention is better than cure. If you can keep people healthy and they don't get sick with whatever condition, mental health is a particularly strong example, it's better for everyone, right? It's better for the person because they stay healthy, they stay happy. It's also better for the business, right? Like, if you want to be really a little bit cutthroat about this, this is a tool for productivity for the business, because your workforce is healthier, happier, and therefore more productive. And I think that seeing the way that the Before Blue service had been designed was super inspiring for me, because it really felt very much like taking that same approach to prevention is better than cure. And as you said, Greg, that sort of evidence-based approach to the actual coaching sessions is so important. And just, everything about the way that the service was designed was really exciting for me to see.
Yeah. Well, hey, look, Sam, I'll stick with you for a second, because I hear about, the vision and the big picture that Greg paints in terms of the Before Blue program. That's really clear in terms of, we need a consistent program that's perhaps multimodal, and then really strong focus on the measurable outcomes and visible for individuals and for the company. You're not really going to be able to do any of that without some form of technology involvement, obviously. But when I think about the type of stuff we're dealing with in terms of mental health specifically, and as Greg already pointed out, the anonymized data, and we're in an age generally where there's a lot of distrust about anything of authority in the broader public. How do you go about building some of these tools and technologies that actually instill trust and confidence in the individuals that are using it?
Yeah, that's a really good question. I think you have to start with the fundamentals, right? The fundamentals is you are going to be dealing with people's sensitive healthcare information. And the most important thing, if you do nothing else, you need to make sure that data remains safe, secure, and visible to only those who should see it. So that really has to be the grounding for every decision you take when you're making technology in this space. And then you have to build on that and understand who you're interacting with. Who is going to interact with your software provision. In the Before Blue case, we've got a really wide range of stakeholders, from individuals accessing the service through to coaches providing the service. And then, almost as importantly, the employers seeing that aggregated data at the end of the process. And understanding what each of those different stakeholders needs is really critical when you start designing a piece of software that can account for that kind of service delivery. So it can't be a one-stop shop. Here's your software, you put you type your notes into it and then you're done kind of thing. Like it has to meet the business, it has to meet the individual where they are, and make it as easy as possible for everyone to interact with. So you have to be extremely user-centered in your design. And then just to hit that point again, every time someone interacts with your software, you have to make sure that they know that their data is going to be safe, because there is nothing more important than that.
Hey, I'd love to learn more too, as an ops person by heart, and the implementation and even prior to that, the design and the build of these types of solutions is where, you can have the best idea and the concept in mind, but if you can't turn it into a reality, then, that's the final output of it. There's this messy middle part in the middle that, Sam, I imagine you're pretty involved in taking this concept and taking it to a reality. Maybe walk me through some of the process and how like Meddbase worked with Beyond Blue to build this thing of Before Blue to take it from the idea to real.
Yeah, definitely. I mean, I think I'm going to say something that's maybe a little bit strange for someone who makes software for a living, but you have to start by ignoring the software, right? You have to say, what is the service design? How are we going to provide this service to the people accessing it? You need to get that down really well. And I think, the team at Beyond Blue did an amazing job of this. So by the time we were brought in as a software provider, they all already had a really strong vision of how they wanted people to interact with it. Okay. And then begins the process of turning that into reality, as you said, Pete. And that's kind of where, we leverage first and foremost people skills, right? People have to make sure that they understand the process, that they understand the person who's going to be interacting with the software at the end of it, and how they want to do that. And then we draw on the software toolkit that we have access to. And, the way we approach these things is that it is not a out of the box, oh, you're in mental health, you get the mental health product, and we hope you like it kind of thing. Like we very much like to meet our clients where they are and make sure that they can run their business in our software. So it's about turning the service design into software design. And thankfully, we get to do that through configuration rather than by writing code, which means we can be a lot quicker, right, in iterating. So we can do some configuration alongside our client, show them it, get them to use it, get them to interact with it, and then start making changes based on that. And so we can make sure that by the time we get to the end of that implementation process, everyone's really happy with the end result, and that we've taken into account all of our different stakeholders, right? How does the person interacting with the service need to do that? How does the coach need to interact with the service? And as much as possible, try to remove as many elements of interacting with the software manually as possible. Try and reduce clicks, because it every time someone has to click a button, it's a fraction of a second where they're not interacting with the person who's accessing the service and talking to them. And that's really what they're there to do. So we try and reduce that stuff as much as possible and just let the people be people.
Yeah, that's cool. I like the people be people. I'm thinking though, and I could be wrong, but it's one thing you could build a fresh thing from scratch and it lives in its own little microcosm. But as we all know, things need to connect to other things, and integrations usually take what would be a nice solution and almost starts to lower your expectations because, well, this thing needs to connect to this, otherwise we can't do that. How did you approach any kind of need for integrating into the rest of the Beyond Blue, or in fact any other ecosystem? Because healthcare interoperability is always an important thing too.
No, absolutely. I mean, that is the word, right? Interoperability. And I think having a really solid foundation for the way that we interact with the outside world, whether that be, system-to-system integrations or how we interact with external stakeholders, right? So like, how does a service user access the system? In the Before Blue case, we used our patient portal API, which is a set of tools that software providers can use to say, I want my member experience to look like this, and then importantly, leveraging those sort of out of the box bits of configuration that we have in the system to personalize it to them. So it has to be easy to work with, right? That interoperability makes it so that it is easy to work with, but it also has to be easy to use, right, for the end user. And so having that mixture of standardized, almost like components, but with enough flexibility to shape the journey that the person's going to go on, I think is the key to making interoperability useful. Because it's one thing to say, oh, we send data out in a standard format, but it's another to say, we send data out in a standard format and we match your business process while we're doing it.
Yes. Yeah, the what for, the problem it solves. I think that's always going to be important because we can get a bit carried away. Greg, I'd love to learn, because we learned a little about like what Before Blue is and a bit about how it might work under the hood. In terms of what you can show for it, are there particular outcomes or benefits that you can walk me through?
Look, absolutely. As we said, this is a real strength of our model. We're really focused on a couple of things. One is the experience, and again, Sam's description of our focus on making sure it's a really good experience for people will make it as easy as possible for them to get help. And so we ask people about their experience consistently. Do you feel heard and understood? Would you recommend the program to other people? NPS style questions. But we're equally focused on, is this service actually working for you? Are you feeling better? We use gold standard measures for mental health outcomes. So we use a depression, anxiety scores, and then we use a work and social adjustment score. So we know, is someone feeling less distressed? Are they feeling, is their depression decreasing? Is their anxiety decreasing? Is their functioning improving? And what we see consistently is really, really positive results, both in terms of their experience and in terms of their mental health outcomes. So on average, we see over 60% of people who enter the program at the start of the program have symptoms of a mental health condition. By the end of the program, they have recovered from a mental health condition. That is, incredible results. Of those people who might not reach that recovery, we're seeing really high rates of reliable improvement. So regardless of if they recover or not, significant majority of people are saying, my mental health is getting better because of this program. So we're making a difference in the areas we want to make a difference. But importantly, we're also making a difference for how they're turning up at work. So, 82% of the people who've gone through our program so far have said, I feel more productive at work because of this program. And that's really important for them, for their own well-being, but also for the business as well.
Yeah. Well, geez, if I took back to the employer's point of view for a second, and if I took that very mechanical or P&L approach to running a business, and in the end, it's about the shareholders type approach. Even then, like if you take a mechanical, you look at your car, you get. I just had my car serviced yesterday. That's why it's on front of mine. And it was expensive, but that's what you do. Is what you do because you need to, because it'll break, and then you do the oil change, you do the tire, you flip the tires. You've got to maintain things, and even before they're broken, and there's some things I don't understand about my car. I don't need to, because this is what you do to ensure it's optimally performing. And if I was really into cars, I'd be doing extra things to it to be able to make it even better. If I was apply that to that machine being my company, the most important tool you have by far is the humans involved, and humans are much more complex than vehicles. So being able to have the tools available to invest in the upkeep and the optimization of those tools, it seems like a no-brainer.
I think that's a really positive point, because, as you say, even if you become super cutthroat and you just say, how do we maximize profit, this is still the way to do that.
Yes.
So that's such a good thing for us as people who work for companies, right? We can be really thankful that the best way for our companies to become more profitable over time is for us to be more healthy as individuals.
Yeah. I couldn't agree more. I think no matter what your motivation is, this program will meet that motivation. So if it is your business outcomes, people will be more productive. And the evidence around good mental health and performance is indisputable. If your staff are well, if they're engaged, if they're happy at work, they're connected to others, you'll be more profitable. You'll have higher productivity. You'll have higher engagement. You'll have higher retention. You'll attract better employees. So the business case is there. But let's not forget, every statistic we talk about is a person. And these are life-changing results.
Yeah, absolutely. I'm just thinking about sometimes we talk about organizations and everyone within an organization goes, yeah, absolutely, we should. But then no one really owns a thing. And you could say that, it's everyone's responsibility. But who do you find generally, Greg, you're engaging with? And actually both of you, to be honest, but within an organization, is it HR?
Oh, look, it is often HR. It's workplace health and safety teams. It's leaders. It's CEOs. It's chief people officers. It's chief operating officers. It's team leaders. It's mental health at work is actually a shared responsibility. But the decision makers we often find are those chief people officers and either the HR or workplace health and safety teams.
Yeah, and I think that's a bit of a changing picture, right? Like, if you think about historically the way that workplaces managed health, it was occupational health and it was the safety team who were responsible for it. And there's a real shift in the industry now, a really positive shift to become this whole organization responsibility. And often it is, and it should be, the people right at the top, right? Your CEO who's saying, this is a priority for the business because we can't run without our people.
Yeah. Well, if I took that, was in the shoes of a forward-thinking HR manager, leader within an organization that perhaps is in a culture that does need work on, realizing the value of this type of investment into people and mental health and tools that would enable you to optimize all of that. How do you start to, any tips or advice, Greg, in particular, in terms of, turning the dial, influencing, getting that positive change that hopefully can happen from within?
Yeah, look, I think as a starting point, it's understanding where you're at in terms of your maturity around these things. So if you're starting from scratch, you need to focus on getting the basics right. You need to focus on getting the foundations in place. If you've already got a few programs already, do you understand how they're working? Have you spoken to your staff about whether they're accessing them and whether it's resonating with them? And then if you're getting close to maturity, you need to focus on where are your gaps. There's really good best practice around what a good mentally healthy workplace looks like. So how have you audited yourself against that best practice? But when people ask me that question, the main thing I say is focus on what works, focus on evidence-based effective interventions. Don't be swayed by the latest thing. Don't be wooed by the yoga and fruit bowls. Focus on good, effective solutions in the workplace.
Yeah, well, speaking of fruit bowls, specifically it does. I guess there's a reason why people would look at let's do an awareness campaign around mental health in the workforce, because often that might result in various versions of emotions or sure, we'll just get through it, or maybe because we have to. But I feel like that there's a difference between doing an awareness piece and something that's actionable and tangible, like you've kind of pointed out, right?
Absolutely. I think awareness around mental health has grown so much over the past 20 years, 25 years. Just running an awareness campaign now, it's not really going to cut it anymore. You need to be focused on behavior change. You need to be focused on action for mental health. It's not good enough just to raise awareness about things anymore. How are you backing that up with tangible solutions?
Yeah. And hey, starting to close out the conversation, but Sam, when I think about, in this emerging world of technology, which can sometimes be a cause or an issue around mental health, it also opens up these opportunities like we've talked about in addressing things at scale. There's a lot of new tools and approaches available, and Meddbase globally addressing healthcare issues. What are you seeing around corners, and what's exciting you about what people are asking for in terms of utilizing technology to address some of these issues?
Yeah, well, actually, the Beyond Blue are such a good example of what excites us about the healthcare industry as a whole, and it's being a combination of really user-centric, understanding how people are going to interact with your service, and then being really excited by data and being able to use that data to, prove that your stuff works, right? Like that's kind of, again, baseline. Like we can provide some supporting data to say, hey, this thing works, but then also using that data to continuously improve the way that you deliver service is, I think, those two things combined represent the biggest opportunity for technology to improve health, is making sure that people can access it in a way that makes sense to them, no matter who they are, and then using the data that you collect in a responsible way, but in a way that helps you continually improve the management of a population health issue, right? Population health could be mental health, it could be diabetes, it could be workplace hazards. All of these things really come down to making sure that you collect the right data in the first place and then using it correctly afterwards. And that sort of shift towards seeing people as entire people and how technology can help you do that, I think is a big shift that we're seeing, particularly in the increasingly employer-involved healthcare world that we're moving towards, really globally. That's happening everywhere. And being able to do more of this stuff in a way that makes sure everyone feels safe while interacting with, but then also giving you that rich data set to help you make it better, I think is just so exciting.
Yeah. I love that. And lastly, then, Greg, for Beyond Blue and Before Blue, for those that are keen to learn more, I assume check it out online. But where are your priorities at over the next kind of 6, 12, 24, and what's keeping you busy?
Yeah, I mean, look, it's all about, as I said, for us, it's all about earlier intervention. So our big focus is on how do we shift behaviors, how do we shift norms around the way people think about mental health, so they're not waiting until they reach crisis before they reach out for support, and making sure that we have really good, effective products in place to point them towards. So we've got a suite of solutions that we can match to their needs and their preferences. It's really critical, and just picking up this thread on the promise of digital to help solve some of these issues. In Australia, we know there's huge workforce pressures. So trying to get in to see a psychologist is really challenging for some people. The stats tell us about half of all people who are experiencing a mental health condition aren't getting the support that they need. And this is where digital mental health shows so much promise. So the work that we're doing with Meddbase and our fantastic partnership, opening up new channels for people to get early access to support as soon as possible.
Yeah. Such a good message to leave on, gents. I feel like we could have this chat for a lot longer, but we're going to have to leave it there. Greg Jennings, Sam, I really appreciate you making the time for this conversation. Also for Meddbase, THT Plus partners helping make this conversation possible. Check out their listing on the Talking HealthTech website. Until next time, thanks so much for joining.
Thanks, Pete. Thanks, Greg.
Thank you.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.